My next guest is Dr. Sheetal DeCaria. She's a double board certified anesthesiologist, pain physician, and author of the new best-selling book, Break the Chronic Pain Cycle. Dr. DeCaria has cared for numerous patients who've traveled for their medical care, and she's here with me today to share her insights. Thank you so much for joining us on the show today.
You're very welcome. Thanks for having me.
Well, travel for medical care is not only to tourism locations, it also happens within the United States, am I right?
Yes, absolutely.
So why would people choose to leave their own state, say they live in New York, or say they live in New York or New Orleans, and go to another state for other hospital systems to a city like yours, like Chicago and the University of Chicago?
So there's a variety of reasons. Some people are from very small cities and they're looking to travel to get more specialists that maybe aren't available at the areas that they live, or hospital systems that offer surgeries or procedures that they can't get more locally, and they'll travel to various people for that. And then other people will travel because they live in another part of the country for half the year, but they've established care in their home state. And that's true for a lot of my patients that go to Florida, for example, for the winter time. They've established their care in Chicago. And so even during the 6 months they're in Florida, they will travel back to Chicago for all their health care because they want to continue to see the doctors that they know.
So what types of procedures are they looking for?
So there's a variety of procedures people will travel for. When I was at University of Chicago, we did a lot of specialized surgeries that may not have been offered at some smaller hospital systems. So things like robotic surgeries, something called an LVAD, that's a left ventricular assist device. It's basically a mechanical heart that can be placed. These type of things, we would see people traveling from other states and even other countries to come to our hospital system to get those done.
Is your hospital and facility set up to help these people with their recuperation period in terms of lodging and care of that nature?
So I'm currently now on my own in an independent clinic, but when I was affiliated with the hospital, yes, there was a lot of people that would be able to work with the hospital for different things like that. I know some of the children's hospitals will have actually even almost like a hotel set up near the hospital so that family members would have a place to stay, and people that would be coming in for, let's say, a cancer treatment or something where they would need to be there for a long time, they could stay at these facilities as like an extended care place.
So how has COVID affected the practice of medicine with respect to people traveling for their care?
So COVID has disrupted so many parts of our lives, but travel has been impacted even greater than I think a lot of other things. If we look back at last April, on average in a day, there was 2.5 million Americans flying. But back in April, there was only about 80 or 90,000. So there was a great reduction in people flying for everything, and certainly probably for medical care. We saw that elective surgeries were actually halted for a period of time. And even now, even though we have picked back up, things are still slower than they were before. We're using telehealth. Surgeries aren't happening at the high frequency they were before. So I really think that medical care travel has certainly been impacted by COVID.
So have you seen, as this starts to pick up, have you seen the health of individuals affected by this?
Yes, I actually am. There's a couple things. So there's the people that have gotten the infection, and there's the long hauler syndrome that we're seeing where people are experiencing fatigue and other just changes from the virus itself. It's not affecting everyone, but there's some. And then there's all the effects of those of us that have been sheltering in place, our disrupted lives. There's a lot of mental health effects we're seeing, a lot more depression, stress that is heightened for sure than it was before the pandemic. So there's that. And then there's people who are just delaying some of their appointments, their blood work, surgeries, and things like that, just due to the pandemic and the way that we're handling healthcare right now. So there's been a lot of effects, I think, for people.
Well, that's what I was thinking. If you have people that are, people are putting off their care. Say they live in Florida and they want to come back to Chicago to see you, but they put it off for a year. I would expect that's affected a part of their health and their progress with health.
Absolutely. A lot of my patients, especially last winter, were not able to travel home. And so many of them actually had to establish doctors and care where they were because, a physician, even though we are doing telehealth, if we aren't licensed to practice in Florida, we really couldn't do much for them, from Chicago. So I would encourage my patients, and especially anyone that has another home or where they're at for 2-3 months of the year or longer, to establish at least a primary care doctor in that location, because you never know, and you always want to have somebody close by that you can reach out to.
That's great advice. You know, I always ask people, can you share a story of your experience with patients who travel to you from out of state?
Sure. I remember when I was at University of Chicago, again, there was a young child that had what's called a Chiari malformation, and that's just an anatomical issue of their spine and back here. And she actually was a child who traveled for a surgery, and then afterwards did have some chronic pain issues. And so I continued to follow her for years. Actually, I had her from the time I was in my training there as a resident, and I took care of her all the way until I was on faculty, and just really got to see her grow from a child to an adult. And they traveled for, all their follow-up visits and all their pain clinic visits from out of state. And so we got really close, and it was a nice case.
It's very gratifying, right?
Yes, definitely.
So where can people learn more about you and the types of services that you provide?
Sure. So my website is www.DeCaria.com, and my book, Break the Chronic Pain Cycle, is available on Amazon, Barnes & Noble, and wherever books are sold.
Well, thank you so much for spending your time with me on the show today. It's been a pleasure, and I hope people travel to see you as things get back to normal.
Thank you.
Okay, take care.
Take care.
We have to take a short break, but there's much more Finding the Good Life to come. Stay with us.